In the old days, when you were really sick and had to go to the hospital, you would get a visit from your primary physician while you were there. But that is a rare occurrence these days, and that's actually a good thing. Hospitalist Elizabeth Cook explains.
So in the traditional model that a primary care doctor would actually come from his office and round on a patient and see them and take care of them, but that consisted of about 7 to 10 minutes in the morning, and then they were off to their office. So there was a realization about 15 years ago that there was more intensity of care that was taking place and that needed to take place in the hospital. So the hospitalist group was born out of that. So we have doctors in the hospital 24 hours a day, where we're here to deal with the patients for, kind of in real time as things develop, as test results come back. If patients become unstable, we're here to stabilize them and address them and coordinate with specialty care. So it's really replaced the primary care doctor in the hospital, but it's actually added a lot of value to the care of the patient. We involve the families in the care. We are actively engaged in meeting with families throughout the day to see what needs are going to exist once the patient leaves the hospital, to make sure that those capabilities are going to exist, and if not, how are we going to provide those services? Is it going to a nursing home or some type of rehab facility? So we really, while the patients have lost that one-on-one, I've known Dr. Smith forever and I don't get to see him anymore, they've actually added, there's a lot of more robust services that are now available and taking place in the hospital with us and being present 24 hours a day.
And I think there's a lot of comfort, too, that you can talk to Dr. Smith, get an idea of this patient's past history, and then continue with that.
Right. So we do coordinate with the primary care offices. So most of the primary care offices here in town do not come and see their patients in the hospital any longer, but coordinate with us. So if you went to see Dr. Smith or Dr. Wade at Medical Associates and needed to be in the hospital and he, assessed you that day, they can call us and say, we think Mrs. Jones needs to be in the hospital, and we can actually admit patients from the primary care office directly into the hospital and bypass the emergency department if it's an appropriate case. And then we take care of that Mrs. Jones while she's here for those 3 or 4 days, and then we coordinate with the primary care doctor when they leave, where we send them reports and we'll schedule appointments and we'll tell them, our recommendations for medication changes, for follow-up testing. So we try to maintain this seamless integration between the outpatient setting and into the hospital, and then back out of the hospital into the community.
And one thing you were talking about earlier is talking about, talking to the patient's family. And people aren't staying in the hospital as long as they should these days, are they? So talking to the caregivers is very important.
Right. Yeah. Again, 20 years ago, grandma could come in and stay for 6 or 7 days and kind of get respite care. But nowadays, insurance companies and Medicare really are being very stringent about criteria for having people in the hospital. So we, unfortunately, sometimes they're more aggressive than even we as physicians want to be, and we have no choice but to try to coordinate care in the outpatient setting and get people, set up to be cared for at home. So that relationship with the family that is built over the 3 or 4 days that the patient is here is really key to ensuring that the patient is going to get the services that they need. That the family, if they're taking the patient home, is going to be able to help and provide the care that they need at home. So that family relationship, and while it's not as long lasting as a relationship with a primary care, it's a lot more intense, and a lot takes place in a shorter period of time, but allows us to really make sure that the patients are going to get the care they need once they leave the hospital as well.
And you also have a relationship with a lot of specialists here. So if they need something else, the patient, you can say, hey, come on over, can you check this out?
Absolutely. That's one of the strongest parts of being a hospitalist. Every day I talk to cardiologists and gastroenterologists and orthopedics and surgeons, and so we have a lot of FaceTime where if I have a question, about any kind of subspecialty problem, I can pick up the phone or just go down and find them down in the OR or something and say, hey, what do you think about this? Can you take a look? So we have a really real-time, vital working relationship with the specialists, which, facilitates the care of the patients.
And if you'd like to learn more about Medical Associates of Central Virginia, you can give them a call, 434-947-3944, or online centralvamd.com.